Welcome to the Sunshine Training Center. In this video, we will demonstrate how to use a special triangular wedge with elastic bandages for finger extension passive stretching. This technique is particularly useful for therapists working with patients recovering from post-burn scar contractures on the hands. We will explain step by step how to position the forearm, wrist, and fingers to achieve targeted stretching while ensuring safety and effectiveness. For tips, how-tos and videos on burn rehabilitation, be sure to subscribe to our YouTube channel or visit our blog at www.sunshinetraining.org. This video was prepared by Karen Shao, occupational therapist and senior rehabilitation supervisor of Sunshine Foundation. What is the special wedge? If you watched our other videos using the standard triangular wedge to demonstrate passive stretching, you could say that the special wedge is an upgraded version of the standard wedge. It features the same stable, sloped surface with padded cushioning, but it has additional horizontal and vertical wooden strips at its base. These strips act as anchor points for elastic bandages, allowing precise control over the stretching direction of individual fingers and thumb joints. With this design, therapists can achieve MP and IP extension stretch for the fingers, and thumb CMC abduction and extension stretch. How to use the special wedge. Here is a step-by-step technique for using the special wedge. You will need a special wedge, 2 Velcro straps to secure the forearm and wrist in place. You will also need elastic bandages. We recommend preparing 3 rolls. 2 will be used to wrap the hand and fingers. The third one will be placed underneath the front edge of the wedge. Placing a small rolled towel or a roll of elastic bandage under the wedge's front edge elevates it, making it easier to anchor the bandage to the wooden strips. Start by positioning the forearm on the wedge. Ensure the MP joints slightly overhang the edge of the wedge to allow proper stretching. Secure the forearm with 1 Velcro strap and the wrist with another, ensuring the straps are snug but comfortable. An important reminder is to avoid having the hook side of the Velcro straps facing towards the skin of the patient. The Velcro hook side should face upwards, away from the skin of the patient, to avoid skin irritation or snagging pressure garments. When force is applied to extend the MP joints, wrist extension may occur. To prevent this, secure the wrist firmly with the Velcro strap. Avoid placing the strap too close to the palm, as it can interfere with thumb abduction and extension. We'll now use the first elastic bandage to secure the metacarpal area and stretch the thumb. To keep the hand flat and stable on the wedge, secure the palm at the metacarpal level using the elastic bandage. To prevent wrist extension during finger stretching, it's also possible to begin by wrapping the elastic bandage around the wrist up to the palm area. Next, wrap the thumb and anchor the bandage to the wooden strip on the side. Focus on stretching the CMC joint into abduction. When wrapping the thumb, the bandage should be between the MP and CMC joints to ensure CMC abduction without MP hyperextension. The second elastic bandage is used to wrap the fingers for stretching and extension. When wrapping the fingers, you can start wrapping the bandage either underneath or on top of the hand. Use a 2-inch wide elastic bandage and adjust tension as needed. A fully unfolded bandage covers the whole finger and can also create gentle pull for PIP joint extension. A folded bandage only targets MP joint extension by anchoring closer to the proximal phalanx, so there will not be any force on PIP joint. Avoid applying force with the bandage directly on the distal phalanx, as it may cause DIP hyperextension. For the little finger, be cautious, it has limited wrapping space. Slightly fold the bandage to maintain control and prevent excess pressure. When working with hands that have intrinsic tightness, you may notice thumb abduction, finger MP flexion, and a narrowed thumb web space. To address this, focus on stretching the thumb into CMC abduction and MP extension. Secure all 4 fingers in MP extension for better overall effectiveness. Remember, stretching only the thumb without securing the other fingers reduces the therapeutic benefit. When using the elastic bandage over the thumb, we want to avoid thumb MP hyperextension. If the bandage is placed too far forward over the thumb, it may cause MP hyperextension, so adjust carefully. If you notice MP hyperextension, first, reposition the forearm's radial side closer to the edge of the wedge. This improves alignment and tension control. Then, wrap the bandage over the thumb, between CMC and MP joint. The special triangular wedge, combined with elastic bandages, is a good tool for achieving precise and controlled passive stretching of the thumb and fingers. By carefully securing the forearm, wrist, and fingers using the described techniques, therapists can effectively achieve therapeutic outcomes, while avoiding unwanted and incorrect effects, such as wrist hyperextension or thumb MP hyperextension. This technique promotes improved hand function, mobility, and overall recovery for patients with hand contractures. If you found this video helpful, don't forget to like, share, and subscribe for more rehabilitation tutorials. For additional resources, visit our website or check the description below for related videos and articles.